what is internal medicine? What is geriatry?
Right, they become frank diabetics, frank hypertensives,
What is internal medicine?
helping the body bring it back.
Right. So why medicine?
They suddenly become diabetic.
Post-meal crash also leads to diabetes.
There is increased insulin in your body.
Moving on to the serious topic, autoimmune disease, right? What is it first?
Fight against itself.
What internal medicine is all about? Aging is inevitable. Aging well is not impossible. This is a very cheesy statement, isn't it? So this has been going in my mind for quite some time, being a daughter-in-law, and also a person who is aging. I really want to connect with the expert and understand what is it to be healthy and age well. So today we have an expert from the field of internal medicine and geriatry. Everybody should be wondering what geriatrics is. Let's get the exact information from the expert, Dr. Nishmitha. Thank you so much, doctor, for coming today, and this is truly a wonderful initiative from all the doctors to talk about different topics, and especially to have come to go make a difference. So it really means a lot. So could you please introduce about yourself to the guest?
Thank you so much for having me here. You people are doing a great job in having this podcast and getting people the right information, filtering out the noise and getting people the right information. So I think it's a very great initiative and I must congratulate you on that.
Thank you so much.
So coming to me, I'm Dr. Nishmitha. I'm MBBS MD Internal Medicine. Then I have done a postgraduate diploma in geriatric medicine and also MSc Psychology. Currently working at physician and consultant at various hospitals.
Okay.
And I have my clinic in Pune Pragna Layout.
Awesome, that's amazing. So, doctor, I think by now our audience should be thinking a lot of things. What is internal medicine? What is geriatry, right? So, can you please tell us what is internal medicine? Is it equivalent to a general physician? What is it?
So, basically, internal medicine is general medicine, but then it is not equivalent to a general physician as such. See, basically anybody who has done MBBS can be called as a physician.
Okay.
But there is slight difference in how it is being portrayed outside, because people who have done Ayurveda, homeopathy, Unani medicine, everybody nowadays is calling themselves a physician.
Okay.
So there is separate branch wherein there is family medicine. They look after adults, children, pregnant women. So they constitute something called as family physicians. Then there is general medicine, which you do after your MBBS. There is a MD in general medicine. So we basically look at the body as a whole. We integrate all the systems, and any deterioration in any system, we kind of treat it as a whole. So after MD medicine, usually people specialize into nephrology, cardiology, gastroenterology, all of these super specialties. In abroad, we call internal medicine doctor as an internist, but that concept is not there as much in India.
Okay.
It seems like we are kind of getting lost in the, the whole lot of people. But then I find that it is the center from where everything gets controlled and treated. So internal medicine doctor has to be a center point wherein all of your complaints have to come to them first. They see it where it fits into all of your systems, and then refer if it is something beyond what an internal medicine physician can offer.
So is it something like a physician where I can just go and say my basic complaints and then you refer to a specialist?
Right.
So something like a family medicine only?
No, family medicine usually deals also with gynecology, pediatrics. So those people deal with everything. We basically are into adult, and slowly it is branching out into geriatry as well right now.
Okay.
So I would say that if you have any complaints, first visit a physician. So like say if you have a headache, you visit a physician. So they will tell you whether it is due to eye problem that you're having it, there is some BP that has shot up which is causing you a headache, or it is a something more serious. Are there any red flag signs? Are you having vomiting? All of these things get assessed rather than you going to a eye doctor first, them referring you to a neurologist. Instead of running pillar to post, there is a central branch which takes care of all of this trafficking, what you can say. And then that prevents a lot of, acha, I went to this doctor referred me somewhere else.
Yeah, right.
So that kind of gets avoided if you visit a physician first, and then you can follow up with them for life also. Whatever problem comes, you approach them first, and then they tell you what needs to be done regarding this, or it needs any referral.
If I have a fever, for example, right, can I come and see an internist?
Yes, that is the first place that you have to come.
So, general physician is an internist.
Right.
Can I just put it that way?
Yes.
Okay, got it.
But nowadays, lot of people are calling themselves general physicians.
Yes.
So that
yes,
is where
that's
it
the
is.
difference. Got
Yeah.
it. Okay. So, in modern medicine, an internist and a general physician are more or less the same.
Yes,
Okay,
right.
got it. So, going back a little, right? So, why medicine?
It's a little elaborate story. As a kid, post say your 10th. So I have always been a studious kid. Okay, I topped the state in my 10th standard exam. So when they asked me this question, what next? I was clueless. I wanted to do what everybody was doing. So the headline next day was Thyroid girl tops the state, and then topper ICE software field, because everybody was doing that. So once I got into my PUC, I came to know that maths is not something that I am comfortable with. I can do it for the sake of marks, but then it's not something that comes naturally to me. And whatever field I got into, I had to be good at it. So biology was something. So with biology, I slowly went into medicine, thinking that I'll do medicine, MBBS. After that, go into civil services or something of that sort. But once I got into MBBS, I got to know that, this human body is such an intricately designed thing that any deviation from the normal, like what we call homeostasis in medical terms, the body has mechanisms to kind of revert and bring it back into balance. So this kind of baffled me at that point, because to form a machine, we need so much of thought, so much of study. So there's something that is there which is kind of divinely done, right?
Right.
So for a human body to have such intricate mechanisms in place, there was something that was higher. The kind of belief that I had about the higher power, it was kind of an eye-opening moment for me. Then from then onwards, there was no looking back. I had to go into medicine, because medicine is something which looks everything from all different angles. And I am that kind of a person that I want to know everything about one object. So even as a student, I used to consult multiple textbooks if I have to understand the mechanism properly.
Okay.
So medicine is something that provides you all the answers. And then slowly, after I was done with the physical body, I got into what influences things in the physical body. So that's when it was kind of, went into psychology during the COVID times. So then I had to get that, and slowly as I started aging, I saw that there is a need for a different field altogether that kind of gets missed in your general practice, right? So in general practice, with the number of patients that you have, you cannot give them the time that it requires for an aged person, right? So you have to look at it at a different angle. So that's how geriatry happened.
Okay. That's interesting.
So that's a long monologue.
Yeah. But that's quite interesting. Okay.
Yeah.
So are you from a family of doctors by any chance?
No. Not on either sides.
At all.
The father you dig, there's not even one medical bone in the family. I'm the first doctor on both sides.
All right. That's amazing. So moving on to the serious topic. First, let's start with internal medicine and then go to geriatry as well. So, as you said, internal medicine is general physicians, right? So in today's generation, the stress life that everybody is living, right? What is it that you want to tell as an internist to the general public? First things first, because that's something that's overtaking everybody's life.
Right.
So what is it that you want to say?
See, a couple of years back, medicine was mainly about treating the infections.
Right.
as people are getting more educated and have knowledge about hygiene, the infectious diseases are coming down. There is this what we call the epidemiological shift from infections to chronic diseases. The other name for chronic diseases is lifestyle diseases. Okay, there was this globalization, urbanization that happened in the 90s, post which our lifestyle significantly changed. Everything got easier. The food habits, there was this rapid shift from home cooked meals to processed fast foods. So with all this setting, what we are seeing right now is, even though we had this epidemiological shift to lifestyle diseases, it was happening in older age groups. But right now, more and more younger people are getting affected by this. The age what detected diabetes in few years back, that has significantly come down.
Right.
So we are seeing diabetes in younger and younger age group. So lifestyle diseases is something that the younger population has to think from now. Maybe right from the school age itself, that they have to fine tune their lifestyle in terms of exercise, in terms of food, in terms of sleep, in terms of their mental health. All four are very important.
So if you had to prioritize all of these, right, what will come first?
It is often neglected, but the first is your mental health, right? Because if you do not have the discipline to follow good food, and you are kind of falling into the trap of emotional eating, so no matter what you say, you will not be able to get your diet into track, right?
Right.
So first would be your mental health, then would be your food, then would be sleep, then would be physical activity.
Okay. That's an amazing order because generally everybody will say do the physical activity first and then your food at balance.
Yes.
Mental health is often just there. It's there, but it has to be there, but it is not very important and all of that, right?
Mental health is often the very last thing because why are you sad? Don't feel sad.
Yeah, it's a very logical explanation that people give. Are you crying? Don't cry.
Don't cry.
It's not. There is no why.
Yeah.
It's like just stop it. That's all, right?
Yeah. So
okay. That's an interesting thought. Thanks for that. Yeah. Okay. So then, chronic illness is something that is in the rise. Like you said, hypertension and diabetes in the younger generation is becoming inevitable, is what I should put it as, right? So what are some early signs that everybody should note and should be aware of, right? Initially, when you have hypertension or diabetes, not at the first day it's going to shoot up.
Right.
There will be some starting early signs for anybody. So what are they? Could you please let us know about that?
The body usually has a reserve, like I was talking, no? So it has a reserve, and anything that goes off track, it always tries to bring it back. The body is kind of functioned for that, to bring things if they go off track. So this diabetes and hypertension usually have a long track record wherein the body is trying to bring things back to normal, but then you are not helping the body bring it back.
Right.
Okay, so there is a phase wherein there is pre-hypertension also, there is impaired glucose tolerance also. But both of these things, when people come to me that say that, my sugars have been little off the track, but I am trying to bring it under control with my lifestyle and food and walking, all those things. But then they do not take it very seriously and they're not very diligent in doing that. So eventually what happens, it goes off track, right? They become frank diabetics, frank hypertensives. After that also they keep on telling that I'll get it back with lifestyle. So that is not the thing. There are early signs that you can make out. Like one of the commonest things is this unexplained fatigue, right? Unexplained fatigue, post-meal crash, right?
Yes.
So that is all suggestive of kind of insulin resistance. Then many people have this dark patch over the neck. That is again insulin resistance, acanthosis nigricans. Okay, many young females are having PCOS nowadays. PCOS is a manifestation of insulin resistance.
Oh.
Yeah, PCOS, you treat it with metformin, the same medicine that you used to treat diabetes. Okay. So they are not aware that they are insulin resistant. They treat off their PCOS with something. Then after a few years, they suddenly become diabetics. So it's not suddenly. There was a track record of how it would be progressing in the future, but not many people are aware of this.
So even a small PCOS will lead to diabetes also. Post-meal crash also leads to diabetes. I mean, some signs of
it is a sign that you are some insulin resistance is happening in your body.
Okay.
So long before your fasting sugars, your HbA1c goes off the track, there's something called fasting insulin, which you can check, which will tell you that, see, you're becoming insulin resistant. There is increased insulin in your body, but that is because your insulin receptors is what takes up insulin, are resistant to whatever is there.
Oh, okay.
Okay.
So, I mean, this is for the diabetes part of it. How about hypertension?
Hypertension usually, see, because there is some what we call, to avoid medical jargon, atherosclerosis that happens. Okay, atherosclerosis is basically some deposits that are happening in your blood vessels. This can happen due to increased sugar, increased cholesterol. Okay. So what happens is, it is something akin to a very layman term I'll use, pipes rusting. Okay, if you have your plumbing at your house and the pipes are slowly getting rusted. Okay, you've got a new machine. The motor pump is there to pump water from a lower level to a higher level, but your pipes are getting rusted. Right. So what will the pump do? It will try to work harder to get the same amount which it was pumping previously, but with pipes that are having rust. Eventually the pump will fail because it's working at extra pressure. So that is what is blood pressure. Okay. So your pipes or your blood vessels, the rust is the cholesterol or the glucose deposits that are happening in your blood vessel, and your pump is your heart.
Okay.
So the pump starts getting strained, which you can make out also in your echo and all, that one of the chambers are enlarged. So many people, young people nowadays, they are coming with already enlarged chambers. So they are not aware that they are hypertensive. They just say, I have tension right now, that's why my BP is high, or I have not slept properly yesterday. So they make up excuses for all of these things until it becomes, my BP is 180, but I'm fine. So you don't have to wait for you to be not fine to take action on that.
So, I mean, sorry to interrupt, but there is a difference between hypertension and blood pressure, is it?
Blood pressure, everybody has blood pressure, right? So blood pressure is the thing that is what facilitates the blood circulation to all of your organs. The pressure at which the heart pumps blood is blood pressure. So when it goes beyond certain point, then it becomes hypertension.
And which stays for long also, then it is hypertension, right? Okay. So, I mean, they cannot pre-assume that, my BP is like this, so please check. That is not something that you will have to do, is what you're saying, right? For hypertension, the basic, early signs that we were talking about. For diabetes, we have this crash post-meal and all of that. Like that, for hypertension, what are the early signs is what we were...
See, one thing is, if your parents were hypertensive, you have to keep in your mind that you eventually will become hypertensive.
Right.
If you're having very much salt craving, okay, so you tend to eat more processed foods, you have to keep a watch on your blood pressure. Signs as such, blood pressure signs don't come up unless it has crossed a limit. Okay. So unless your BP is really high, you will not get your headache, blurring of vision, vomiting. All of these you get only when your BP has crossed that danger point.
Oh, okay.
So usually there is nothing that will point you towards that.
Okay. So salt craving, please watch out.
Yeah.
One of the, because everybody, this lace and all that, no?
Yeah. If
that
you've
has
been
become
eating it for long, then definitely. Even for older people, we say that you restrict your salt. That is what it means, right? That to get your blood pressure under control, even if you cut down on 1 gram of salt, your blood pressure significantly decreases.
Ooh.
Yes. So it is basically 6 gram of salt or 2 gram of sodium.
Okay.
So it's like that. So cutting down on salt, cutting down on your weight, all has this thing on blood pressure.
So eventually, if you do that, it is bound to reduce, even if you have a history of blood pressure or hypertension in your family, it's bound to reduce.
See, you have primary hypertension and secondary
yes.
hypertension, right? So, primary hypertension is where there is no cause. Usually, it's a familial thing, and then you have kind of inherited their lifestyle. That is why you have inherited that disease. So, that can be controlled with your weight loss and your diabetic control, with your salt control, all those things. But the secondary hypertension, we need to treat the cause.
Okay.